It's a cancer many men ignore, but prostate cancer is the most common form of cancer in American men and the second leading cause of cancer death in men in the United States. As many as 1 in 6 men are at risk of having prostate cancer in their lifetimes. It's important that men talk with their doctor about when and how to get screened for prostate cancer.
Historically, we've recommended men consider screening starting at age 50. If there's a strong family history, it can be at an earlier age, as young as age 40 in some cases. Or if a high-risk situation exists, such as a strong family history, then screening at an earlier age is acceptable.
At present, there are 2 main screening exams for prostate cancer: a digital rectal exam and the prostate-specific antigen test, or PSA. If either of those tests indicate the presence of cancer, an ultrasound test can be done to look for abnormal areas of the prostate gland. But while generally encouraged, prostate cancer screening is not without some controversy.
Well, the problem with screening for prostate cancer is the PSA isn't a great test. So your PSA can be elevated under circumstances that you don't actually have prostate cancer. And similarly, a patient could have advanced prostate cancer and still have a PSA in a normal range.
Some prostate cancer treatments can cause serious side effects, so it's important to talk to your doctor before making a decision to be tested or treated. But despite the controversy, most healthcare professionals argue that when done right, prostate cancer screening does save men's lives. 60-year-old Frederick Beck had never been screened for prostate cancer before being diagnosed.
I first discovered I had prostate cancer when I came to the emergency room at Willamette Falls, and they told me that my pain in my back was a result of prostate cancer that had metastasized to the bones. And I thought that I was healthy, I felt healthy. I felt no indications that anything was going wrong. And so I think they call it a silent killer, and it was silent.
It's important to note that not all prostate cancers are created equal.
Well, we've gotten a little bit better at figuring out what are the dangerous prostate cancers. If somebody gets a diagnosis of prostate cancer, one of the very important things will be the Gleason score. So the Gleason score is something that a pathologist uses to estimate how aggressive this tumor is. There are some men that are appropriate for, not having surgery up front or not having radiation up front to try and cure the prostate cancer. But certainly, if you have a diagnosis of prostate cancer, it needs to be watched very closely, even if you don't get those sort of definitive therapies.
An estimated 250,000 men are diagnosed with prostate cancer in the United States every year, so it's important to know what to be on the lookout for. Common symptoms of prostate cancer include a need to urinate frequently, especially at night, trouble urinating, decreased force in the stream of urine, blood in the urine or semen, frequent pain or stiffness in the lower back, hips, or thighs, bone pain, and erectile dysfunction. It's not clear what causes prostate cancer. Doctors know that prostate cancer begins when some cells in the prostate become abnormal. Mutations in the abnormal cell's DNA cause the cells to grow and divide more rapidly than normal cells do. The accumulating abnormal cells form a tumor that can grow to invade nearby tissue. Some abnormal cells can break off and spread to other parts of the body. Taking care of your health is something you shouldn't put off.
A regular checkup that includes this, I think it should be included. I think men should be pushed to have this by their wives, by people who care about them, and not by anyone who does a regular health screening for any reason. Should be saying, look, you need to have this done. Just do it. It's not that painful. It's not hard, and it's a little thing. And I mean, An ounce of prevention's worth a pound of cure. It's true.
Affordable preventive care, including prostate cancer screening, is available for all Clackamas County residents, regardless of their insurance status.
We have a variety of mechanisms in place at the county that if you do not have health insurance, you can get hooked into a variety of different sort of systems that will provide you the health care coverage and services at a very reasonable rate of no charge at all.
For more information on prostate cancer screening and all the health services provided by Clackamas County, go to our website, clackamas.us/health centers, or call 503-655-8471.